explain to you about an enema, and these are the boxes that they come in, and here's your little enema packet here. So you'll get it out and clamp the tubing off immediately because you don't want to forget that, and you can just hang it up here on the IV pole for just a moment while you get it all together. Have your patient, put your patient in a left lateral Sims position, but you can do this all before you go into your patient's room. And then this is called Castile soap right here, and what you're going to do is just open it and get it ready to pour into the water. And you're going to warm your water up to about 105, and then you open this enema bag up, and you're going to fill it to about 1,000 to 1,500 milliliters. So let me fill this real quick. And it's about 105 degrees. It's about bath water. And you can see the increments of measurement on the side here. That's 500, that's 1,000. This is 1,500, so it's not quite up to 1,500. Now I'm going to take my Castile soap and pour it in. And then I'm just going to shake it up just a little bit. And I'm going to hang it right back up here on the IV pole. And I'm going to take my tubing, take the end off of the tubing, and replace the air with water, so it's primed now. And the lubrication is in the end of the tubing. So now it's ready to go. So now you're going to place your patient in left lateral Sims position. You can just put this under the patient if you need to. And you're going to put this in the patient about there's a hole in the end for the water to come out, and there's a hole right here. And you want to place it about 2 to 3 inches past the second hole to make sure that it's in far enough. So you're going to put this in the patient, and once you've got it in the patient, you're going to open this up so the enema bag will flow down. And you want this enema bag hanging about 12 to 18 inches above the patient so it doesn't flow in too fast or too slow. If you have it hanging really high, it's going to go in really fast and they're not going to be able to take as much. If you have it low, then you're just going to have it going back into the patient. Once you're finished, clamp this off with your clamp and take it out, and ask your patient if they can hold it as long as they can before they go to the bathroom. And then once they go to the bathroom, they may have to get up and go a couple times. Another type of enema is a small little enema like this, and this is called a Fleet's enema. And sometimes these come with oil in them, and the oil is for fecal impaction. That's when the stool is really hard. You can just put this in like a little enema, just put it in this way, and you want to just fold it over itself when you're putting it in. You don't want to let air get back into it and be putting air into the patient. And the oil is to soften up the fecal matter so the patient can expel it. Another enema I want to talk to you guys about is called the Harris flush, and you just do a soap suds enema, put it in the patient, but if they have a lot of gas and they're feeling really like they have a lot of pain with the gas, you want to lift this high and let it go in, and then lower it, and the bowel and fluid is going to come out in the bag. But with the bowel and fluid is the gas is going to come and rise to the top because it's not as heavy as the water. And when the gas comes out, then they're relieved of a lot of pain, and they may not even have to have pain medicine after that. So that's your Harris flush, where you lift it up, and then you put it down, and you lift it up again, and put it down. Of course, not that fast, but that's to relieve gas. And everything else, these are just a soap suds enema, and that's for maybe surgical procedure or maybe for labor and delivery to clean out the bowel before a baby's born. And that's your enema.
Now see if you can answer these questions.